From childhood, we are taught to brush and floss our teeth. Families and schools encourage regular visits to the dentist and emphasize the importance of good health. But what is often left out is the reasoning behind properly cleansing and maintaining oral hygiene, and why it is so important to continue these behaviors as we grow older.
It's important to maintain good oral hygiene to prevent decay and to prevent gum disease. Both of those things are caused by bacterial plaque in food, and the longer time that food spends on the teeth, they can not only cause decay but also eat away the gum tissue and the bone around the tooth. If left untreated for a period of time, you could actually get gum recession, get bone loss, and that could ultimately lead to loss of the teeth.
Those who do not maintain good oral health are living with swarms of bacteria in their mouth. Brushing and flossing regularly can keep these bacteria under control.
Recession can be caused by bacterial plaque. The body's response to that plaque is it develops an inflammatory response and pulls away. When you remove the plaque or you remove the cause, then the recession should stop. And there are two types of tissue in your mouth. There's a thick, protective, non-movable tissue, and you should have a turtleneck of that around all of the teeth.
When not properly maintained, harmful bacteria can sometimes grow out of control and lead to infections and periodontal defects. And as we age, the chance of developing periodontal defects increase.
When you get gum recession past that turtleneck of non-movable tissue, now you're into the lip-type tissue or the cheek or under your tongue. That's that thin, movable mucosa. That's not protected. So the dentist or periodontist can try to regain that protective non-movable tissue with a surgical procedure.
The Dynamatrix extracellular membrane is a product that regenerates soft tissue. What makes it truly unique is that it not only provides a scaffold for the tissue to repair itself, but it also provides the signals which communicate with the patient's own body to stimulate the healing process.
Not only is Dynamatrix extracellular membrane an effective tissue regeneration product, but it's also easy for doctors to use. Dynamatrix is incredibly strong and can be cut, rolled, stretched, folded, and sutured.
Dynamatrix is an extracellular membrane. It's an alternative to palatal tissue. So for recession-type defects, it can be used either to establish some thick, protective, non-movable tissue, or in certain situations it can be placed over a root and gum tissue pulled up and over for root coverage.
For the treatment of periodontal defects, what's great about Dynamatrix is that it can eliminate the need for tissue to be removed from the patient's mouth. This can be time-consuming for the doctor and also sometimes very painful for the patient.
When you have tissue taken from the palate, which is an old-fashioned way of doing a gum graft, patients are always concerned with pain. It's a second donor site. They're concerned with bleeding post-operatively from the palate. They're concerned how are they going to eat for the next several weeks with this sore area in the roof of the mouth. So if you're a candidate for this graft, there are several advantages for the patient. For the doctor, the advantages are it stays in place for 8 to 16 weeks before it starts to break down. The surrounding tissue will grow over it like a bridge. So it's a conductive type material that epithelial cells will grow over.
Dynamatrix differs from other products that are used in this indication because it has active signals that are embedded in the membrane. And these signals communicate with the patient's body to help remodel into natural tissue.
Some of the other commercially available materials for root coverage have to be covered. When you cover them and the gum starts to pull back maybe in the first week or two, the material turns yellow, it turns green, sometimes it smells, it wicks bacteria, and that's not a good patient experience. The Dynamatrix, it signals other cells, epithelial cells, to grow over it. So it's a big advantage for patients and for doctors. For doctors, it cuts your treatment time in about half. There's no donor site from the palate, you have much greater patient acceptance because of that, and you don't have to worry about bleeding from the palate post-operatively.
Keystone Dental Incorporated was founded in 2006. Since then, Keystone Dental has grown into a team of high-energy professionals dedicated to bringing advanced products to the field of oral health with the ultimate goal of improving every patient experience.
Keystone Dental has a full line of dental implants, which are basically a replacement for your natural tooth, as well as tissue and bone regeneration products and a surgical software that helps the clinician when planning the procedure. We strive to accomplish this by bringing technology to the market that is not only easy for the doctor to use, but also provides a great patient outcome.
Keystone Dental believes that every patient deserves a great smile. Thanks to advances in science and technology, this has become a reality. For more information on Keystone Dental and Dynametrix, visit www.keystonedental.com.